how Fractora works. It's different than anything else that's out there, and there's a little bit of a learning curve when you first start doing this. A lot of the things we've used in the past, and we'll talk to this briefly, the CO2, the erbiums, the YAGs, and everything, you see that change almost immediately, and you see the changes going forward. Fractora is something, yes, you will see changes immediately, but it does take time for that collagen to build. So you have your ablative zone, your coagulation zone, and your zone of heating. And these three different layers are unique to Fractora, and this is what's giving us the results that we're seeing. We're seeing the reepithelialization occur very quickly, and the phagocytosis, which is important for remodeling in the dermis. This remodeling is going to continue to take place over the next several weeks and several months. What that's going to allow for is a thicker dermis, improved texture, and decreased dyschromia. So when to use which tip when? This is something that everyone needs a little time to learn about, and the 60 pin is really going to be your workhorse. This is going to get your moderate density pigmentation. It's going to give you some moderate to deep RF stimulation, and it will get some of the superficial mottled looking appearance of the skin. So anything that's higher up in the skin or mid dermis, you're going to use your 60. Things that are just superficial, you're going to stick to the 126. The pins are much closer together, so you're getting a higher density concentrated area of treatment. So anything that's really concentrated you want to address, you're going to use the 126. Now in my practice, I rarely use the 126 because I really feel the 60 pin addresses almost everything. The 24 tip pin, this is the one that's going to go nice and deep. You really get a nice ablative zone into the dermis, and this is what's going to allow for a nice remodeling of those deep wrinkles that we see. The silicone coated pin is also fabulous for skin laxity. Now the difference of when to use the coated versus the non-coated would be when you don't want this whole ablative and coagulation zone to go from the epidermis down to the dermis. The silicone coated will spare the top and just do tightening. Most of the time I want to see that zone from top to bottom, especially if I'm doing a scar. So again, like I said, coated would be for skin tightening. So how does Fractora stack up? Some of the things we've used in the past that I'm sure all of us in this industry have been familiar with, the erbium, the CO2, and some of the lasers, all address different things. So in order to address texture, tone, pores, resurfacing wrinkles, deep wrinkles, tightening the dermis, and rejuvenation, you'd have to use 3 different devices. The nice thing about the RF is you can tailor the treatment to get one aspect or all of these aspects together. And instead of using 3 devices, you're using 1. The RF itself is colorblind, so for patients that have more pigmentation, you're not as worried about hypo or hyperpigmenting their skin. However, in darker patients, you are always going to be concerned about post-inflammatory hyperpigmentation because you are causing a thermal injury. So when I talk to patients and about the benefits of RF and compared to other devices, I am going to tell them there's considerably less downtime, especially when you look at traditional CO2. There is a risk of post-inflammatory hyperpigmentation, but it is slightly less than the other modalities. It's a workhorse for the face. You know, we're finding more and more great applications on the neck and body. The results are amazing. They're blowing everything I've seen in the past 10 years out of the water as far as what you can get and the amount of rejuvenation you can see in patients. The other thing I want to consider is medications too. Now, I've treated patients that have been on Coumadin and Plavix, and I haven't stopped the medications, but you do need to be aware of it, and you also want to make sure you get clearance from their cardiologist or whomever is prescribing that medication before you treat them. So, Fractora is a revolutionary new technology that addresses the effacement of moderate wrinkles. It's comparable to the CO2. Safely rejuvenate the neck with profound contraction. So, patients that aren't surgical candidates will get a huge improvement from this. Cystic acne and acne scars are showing great improvement with the Fractora, more so than you would think. It's not very intuitive to think it would help cystic acne, but when you look at the science behind it, it makes sense that it will be improving. And it greatly improves scars in the body, and it's safe for ethnic skin with little to no risk of post-inflammatory hyperpigmentation.